Hi, this is Katie Humes. I'm your moderator for today's live webinar from Washington Sensory Disability Services. And today's presenter is Kathee Scoggin. And Kathee, go ahead and take it away.
Thanks, Katie. Hi, everybody. It's great to have you here. I know some of you, I recognize names, and we're going to go ahead and get working on this. Just a couple things right off the bat. We're going to show some videos of some young children, and Katie and Nancy and Diane McCutcheon have all been so good about sharing those videos. And I know that a lot came from the baby jamborees that some of you participated in. So just a reminder that if you recognize a student that you happen to be working with, and if you don't recognize the child, there really is confidentiality issues, and so we would really prefer that you not share anything about that child personally or professionally. Just be aware, and you can certainly inform us later the progress the child's been making, changes in the child. So with that, we'll go ahead and get started. There are references at the end of the PowerPoint for you of places that you could get additional information, and I really recommend that you do that. There's some great resources. Also, Katie's been great about reviewing the handouts, and so with that information, the more you have available, because we're just going to show a photo clip of some of those handouts, and you're not going to be able to read it on the screen. So just be aware of that also. So you're going to need your handout, or at least have it up on your computer where you can pull it up. I'm just checking my notes. So if you're wondering what I'm looking at over here, that's what I'm doing. We did eliminate a slide that I think is very important to share, and that is we give huge thanks to the families and the children and all of you professionals who are willing to allow us to use videotapes that we take. We all know that at any given moment, especially for those of us who might be perfectionists, we can see 13 things we could have done differently. And I'll be talking about one in which you're going to see me in a video, and I'll tell you right up front, you know, the thing I keep saying to people, slow down, slow down, slow down. I would say the same thing to myself. So be aware that it's really courageous of the families and all of you professionals to step up and say, yeah, you can see me, warts and all, so to speak. So with that, I just want to briefly review a couple things. And it is going to be quick, but the outcomes are, the idea for today is to identify indicators that put young children with multiple disabilities at risk for hearing and or vision loss, to identify informal observation tools, to identify sensory learning channels that are strong for the child, and we'll talk more about that. Those are the two, and then the one in May, we're really going to look at strategies to use with students and young children. And I'm going to use students and children interchangeably. My background is one of coming in, having worked, I'm just reminding myself, there is a handout that you have that are the different special education WACs for Washington, definition of deafblindness, which many of you who I recognize know already that deafblindness does not mean totally deaf and totally blind. It means a combination of a vision and a hearing loss. Then there's definition for deafness, hearing impairment, which is similar to hard of hearing. That's our definition in Washington. Developmental delay, multiple disabilities, and visual impairment, including blindness. So I just want people to have that as a reference. I know some of you don't need to use that, but it's something to be thinking about as a child is growing up and aging. So let's start out with a video clip, since I find those probably the most interesting. Let's first, I did remove a slide, and I can't remember if it's in yours. Whoops. Oh, okay. I can't remember if it's in yours or not, but I just want you to be aware that we are here talking about a whole child, not bits and pieces. I'm not the physical therapist only thinking about movement. I'm not the occupational therapist. I'm not the SLP. I'm not the birth to 3. I'm looking at the whole child. So what I would like you to do in this one, and let me tell you how we're going to do it. So we're waiting for Michaela to bring this up, and it'll just take a minute. So maybe we can do a green check before we start it, and what I'd like to do is have all of you who see a picture that it says, I found your hand with a baby and her maybe mother or caregiver, would you check it so I know how many people are seeing the video? Okay, for those of you who put an X because you can't get it, know that this is being recorded and that you can go back up on our website in a few days and you can replay it and you'll be able to see the videos through there, hopefully, that will work better. Also, what we need to do is follow the same thing you would do at home playing a video, and that is when I say the words push play now, go to the small triangle or arrow that is at the bottom of the screen of the video, and what we're going to do is we all may be going at a slightly different rate because of our systems, so we're going to wait a little bit after it's over before we come back to talking. And what Katie usually does is tries to do a visual description, and maybe Jaron does the same thing, but so those of you who can't see have a sense of what the video is. So let's go ahead. What I'd like you to think about is to look at each of these children as whole people first, and then think about what it is that you tend to focus most on when you're working with a child and her family. Or his family, for that matter. Okay, push play now.
Some more. Stand up or sit down. There are people that they might have gone through the class.
You put it in?
Good.
Yeah. Oh, miss.
Good.
Oh.
Girl, yay.
Woohoo! Yeah. I've got 3 more. 3 more, Missy. Yeah.
Oh,
Okay.
What do you do with it, Lily?
she said she put that one back there.
2 more.
That's
There.
it.
They are very good about creating this space.
I think she located that one.
I did too.
Come here.
She went right.
It's fine too when the light is like coming through the window.
She had observed that. Yeah.
Okay, what I'd like to do is have you think about the fact of those 3 little girls and think in terms of what were things that you noticed about the whole piece of that child, not just whatever your part is in this. And if you'd like to type some thoughts in the chat window, that would be great for everybody to see, including me. One of the things you want to think about too that just really hit me when I had a chance to see each of those videos, since I was not there present, was the issue that there was not a great deal of talk. Another thing that I noticed with Aurelia, the first little one, was the way the adult followed her lead. And what better way for those of us who want to try to find out something about that child and to do some informal observation and assessment is to see where they take us, not where, oh, I need to get through this, I have these 4 activities to do while I'm here, etc., etc. Any other comments people want to make about things they noticed about the video? All of the children were trying to explore the toys, exactly. And that exploration is what starts that whole piece of initiation. And we end up finding ways to make children, especially with multiple disabilities, be non-initiators. Not meaning to, but from the very beginning we do that. And we'll talk some more about that. They all succeeded in what they were doing. They all succeeded. Why? They succeeded because we allowed them to do it on their terms, not on ours. Those are great comments. Thank you. So what we sometimes think or say really matters. So we're going to talk about that first, because how I think about a child, how I think about children with multiple disabilities in general, and then what I think about them starts to turn into what I say about them. So here's something that we often hear, and that is, well, he has so many other needs that a mild hearing loss is really the very least of his concerns. Well, a mild hearing loss is a mild hearing loss. And even though it's mild, and it seems like maybe that would take a back seat to something, we need to think about what do we need to do to support that slight hearing loss in order for the child to have as much access to learning and to being and to communicating. She has no hearing problems. She loves music. Another thing we continue to hear. Well, for those of you who work with children who are deaf children, many deaf children love music. Does that mean that they have no hearing loss? No. Music comes in, picks up so many different things than spoken language that's one of the things that we try to remind people, that just because you love music does not mean that you can necessarily understand what somebody else is saying. He sleeps much of the day due to seizures and medications. Focusing on learning and use of hearing and vision is not a priority. Again, I would suggest to you that if you're thinking about the whole child and not just your area, then somebody needs to be thinking about the hearing and the vision. And you may need to be saying, what is it I notice about the child's vision or what they're doing? So I'm going to go back to Andy Rose, who was the third little girl in that first video. And for those of you who may have picked it up, did you notice that when she was playing and hitting the bells, did you notice what she did with her head? Did anybody pick that up? It was subtle. So one of the things that would happen, she was listening. That's right. Great, Lindy. She tilted one ear toward the sound each time. And what the team later found out is that this child has a unilateral hearing loss. She has a hearing loss in one ear. And so she was bringing that sound closest to her better ear. And we saw the same thing when she was in a little space for active learning, and we'll be showing that at another time. But those are some things to think about, is what is the child doing? Are they bringing it closer to one ear? Are they bringing it closer to one eye? Are they bringing it closer to their face, or further away, or to the side? Because we do have that peripheral vision, that vision on the side that we can use. So those are some of the observational things, and this is all going to kind of blend in together. It's very hard for me to just talk about one thing and just stay there. The team that I work with likes to talk about my random thinking. So do I. So one of the things, the other thing I want to make a point about is that there is a woman who's going to be coming to the Combined Summer Institute in Wenatchee. It usually is in Yakima, and it's July 30th through August the 2nd. That's 4 days. And her name is Millie Smith, and she's out of Texas. And she's going to be talking about what we know now neurologically, and how it is you take you work with a child, and how do you find a way to have that child be as alert as possible to be open for learning. Instead of making a general comment, well, he's just not ready. It's not a priority. I know that families, they are just, for some cases, just holding on because they have a child who may be so medically involved. It doesn't mean I'm going to sit there and say, oh, I think your child has a hearing and a vision loss. But it's for me, as a person who may come into the home, to sit and look at the whole child, not just the area I've been trained in. And here's another comment. The child is so involved and cognitively impaired. So what happens sometimes is when I think those things, I then say those things. And then when I say those things, I diminish the expectations of everybody around that child for him or her. And that's not my goal, and I know that's none of your goals either. But that is sometimes what happens. Because I'll hear people say, well, I would try that, except you know how low he is. So I would hate that if something happened to me, a stroke or something, that somebody would talk about how low I am. I may be low, but don't talk about that, because the expectations change. I don't have the expectations then. Here's another thing we will sometimes hear. Well, we're lucky to have both a teacher of the visually impaired, and I know some of you are there, and a teacher of the deaf involved, and I think there may be one or two people on here who are teachers of the deaf. Why would a deaf-blind specialist be an important person to contact? Even after all, the losses are mild. With mild losses for children with multiple disabilities, they become huge. They don't stay mild. They may be medically identified as mild, but they are huge for that child having communication, learning, and being a part of his family, his community, the world. And one of the things that we continually see is that for many of our students who have a combined vision and hearing loss, as they become adults and after they're adults and out of the services, that our project provides and the schools provide, that life becomes one of intense isolation. This family can't handle another disability added to their child's diagnosis. Again, be sensitive to the issues that it's not about me making a diagnosis or some doctor making a diagnosis in the beginning. It's about me watching what that child does with his or her vision. Do I need to find some other ways to supplement because vision may not be working as well? But I don't know that for sure. I don't know if they have a vision loss. And here's a good place to talk about the issue of there's vision loss, there's hearing loss, and then there's functional use of the vision and functional use of the hearing. And we'll talk a little bit more about that. This family can't handle one more specialist coming in. Just a reminder that those children with mild losses, and especially for kids with hearing loss, we have found that even with a mild loss or unilateral hearing loss, students tend to be 2 years behind their academically from their peers. That's a huge thing for all of us to talk about mild or minimal loss when it actually becomes huge for the child. And I think the other thing I want to just say is there are the combination of the vision and the hearing loss or functional use of their vision and hearing is what really is what hampers the child. But also the child who has a vision loss or blindness, or the child who has a hearing loss or deafness with additional disabilities, they are hampered hugely. Think about some of the children that you're currently working with. How many of you are working, and if you put the green check the way you were practicing with Kathee, how many of you are currently or have worked with a child with a hearing loss? Okay. So quite a few of you have. Okay. Now, how many of you have worked with a child with a vision loss or was blind? Yeah. And then how many of you have worked with a child who may have had a combined vision and hearing loss? Quite a few of you. So I'd like you to do a little chatting. I'd like you to share just a few comments about working with children with multiple disabilities and one of those sensory losses, or the combination of what you experienced. What were some of your biggest challenges when you were working with that child and their family, and his or her family? Where to start? That's a great one, Jill. Where do I start? Where are the priorities on this? Has the child been taught a way to communicate? Is there just one way this child communicates? We all think in terms of, this is what I hear with older students, and that is I'll hear this, and by older I mean 6 and above. I'll hear things like, well, she uses a PEC system, a picture system, symbol system, or she uses sign language, or she uses this, or she uses that. And my comment is, you mean that's the only thing she uses is sign language? Well, yeah, and I'll say, so they don't use any gestures. And they'll say, oh, yeah, he uses gestures. And I said, what about facial expressions? Oh, yeah, facial expressions. So it starts to become, what is the communication system the child is using? And the picture system, it may be a part of it. Sign language may be a part of it. Tactile symbols may be a part of it. Touch cues may be a part of it. Object cues may be a part of it. And, you know, how much does this child understand? And so we'll talk about observation, about looking at that. And a big challenge was not just hearing loss or vision loss, but the complicated diagnosis the kiddo had as well. So difficult for families to prioritize what to work on. It's one of those things that if I can stop thinking disabilities and I can start thinking, what is this child's life routine in his family? And how do I fit ways to support that child visually, auditorily, tactily, whatever other way, helps me start to think and observe differently. It's not about me coming up with some things to do. It comes up with, let me see what she's doing and let's see how we can support that. I agree with the complexity, and the cortical vision impairment is challenging. And cortical vision impairment, when we were talking about the idea of a hearing loss and a vision loss, this talks about the use of your vision and hearing. This is not about necessarily having a visual loss as far as in the eye. It's about when it gets up to the brain and how it's going to interpret. You know, we get reminded all the time, those of us in the field of sensory disability, is that we hear with our brain and we see with our brain. We don't hear with our ear. It is the conduit. It gets it into the brain for us to hear and understand and put out. Same thing with the vision. And every child with cortical vision impairment is different. How to get the entire team, parents, therapists, teachers, IAs, etc., to be consistent with this student. That is a great comment because it is difficult. And we're seeing some great results, and we'll share that next time too, but that's another challenge. There are often complicated feelings of denial, guilt, and fear that parents are dealing with. Yeah, and the more I look at, gee, here's your child, and what a joy, and let's just talk about how we support her. How do we support him? What do we do to make it easier for him to be a part of the family? Medical professionals need to be educated on the variety of options available. That's another thing. And I don't have any control over that medical profession, so we'll just move on after that one. But it is. How do we let them know of what the options are too? So let's go on. So I want to tell you a story. And this happened to me a few years ago, and an FRC contacted me and said, we have this child who's very involved medically, and he has a syndrome that suggests that he would have a hearing loss and a vision loss. It is clear to us that his eyes are strange. Just looking at him, they do different things, and it's clear to us that he has a hearing loss. But this family is so involved in the medical part, and that this child mortality in this syndrome up to the first year is pretty high. And so, but we just don't think they can handle one more person, one more specialty. And I said, that's okay. But she said, but we want your help. And I said, okay, so why don't you do a little bit of videotaping for me, get permission from the family so I can just get a sense of who the child is. And then what I'm going to do is you can email me, call me, and we'll talk back and forth before you go out to the next session with the family. And let's talk about how I might suggest to you, here are a couple things for you to look for. So the family never knew who I was. I mean, they knew who I was in that they gave permission for her to talk to me, but they didn't know me. And it was about 6 months later that the family said, okay, we're ready to talk to that person you've been talking to. And so there are always solutions to being sensitive to the families, and you are the people who are the most sensitive. You know, you're the ones with them. You're the ones who have a good read on how that family is feeling. And at the same time, what this is about is us saying to you, yes, that's great, and here are some things you can do, not necessarily having the background of vision and hearing, that you can start to look at when you're observing that child, and that you just simply make some adaptations. That you look at stuff and start writing down some information and saying, you know, I've noticed. So keep in mind on that piece. So that's just a simple story, and all of us have those stories. I'm lucky enough to have a great team I work with. Kathee is excellent. A lot of you know Kathee. She's got a background of working with birth to 3 as well as other things that some of you may not even know. She's used to working with adults who are deafblind in the past, and she's a wealth of information. The other person, of course, many of you know is Nancy Hatfield. You know, Miss Extraordinaire when it comes to that birth to 3 and slightly older population. Nancy's got great ideas, and we've talked recently about some young children. What a great group. And then to do this webinar, we needed Michaela to help out and the transcriber, Jaron, and I appreciate him. All of those people are part of a team so that we have people to talk to. It's not just me trying to wing it. It never is. And if it is, I usually don't do very well if it's just me winging it. So we're going to watch another video clip. And what I want you to notice about this young girl is I'd like you to think about what is she learning and how is she learning. And then we're going to talk a little bit more about her after we're done. And we're going to talk a little bit about her temperament. I got some information that I think is very, very important when we talk about all people who have multiple disabilities, but especially the little young ones. So we're going to do the same thing we did before, and that is the triangle or the arrow, the white one down at the bottom left of the screen. Push play now. So thinking about that, and we always talk about developing concepts. And this is an area that some people confuse with the idea of developing vocabulary, that if the child has the vocabulary, he or she has the concept. So what I'd like you to do is type in the chat room what kind of concepts or what do you think that Rinnie was learning in that experience. Wheels turn when bikes move. So there are wheels. There's something that goes round and round, even if I can't say the words. She was learning movement in another way than just walking. Hard. The concept of something being hard, motion, texture, something being rough. Those are all great comments. So I want you now to tell me, if you had to guess at this little girl's, if you had to guess what this little girl's, I'm going to use the word temperament is, I would like you to put a green check if you think she looks like she's a pretty easygoing child. And you don't all have to agree because it's just a short observation. You didn't get to hear her talk. You didn't get to hear the other person talking to her. Just a visual. So some of you saw her as pretty easygoing. What I want to share with you that one of the adults shared with me about Rinnie is that Rinnie wants to be on the move. And if she had to have been sitting in a chair doing an art project or doing something else, you would have seen a whole different person. So again, what happens is we look at how do we observe to find out the child's likes, their preferences, whatever word you want to use. But how do we find those out, and then how do we make that possible for that child so that the learning can happen? I think there was somebody else. Let me just look briefly at the chat window. I want to see if I got that. Yeah, and Jean, you mentioned that she was starting to explore the bike seat, and that whole idea of exploring the bike seat and then having somebody step in and do something else may fracture what it was I was starting to learn and how I was starting to form and put the concept in some way in my brain and memory so I could start to categorize things. Now, I'm going to say those kinds of things, and that is not any kind of a criticism of the person working with the child. So understand that when I say that, it's being able to see it after the fact. If I had been the adult working, I might have lifted her up the same way. It's when you can sit back, and I'm just going to put this plug in again. It is really important to do videotaping of children. It's so easy nowadays to sit back and look at it together and say, oh, you know, I didn't even notice this. We videotaped a young girl that I was working with a few years ago, and what I didn't pick up until I got the videotape home and looked at it is she was signing down at the side of her body the answers. And I was sitting there looking at the hand that was up here and her head and her face, and I wasn't looking down at the side. Those are the things you can pick up sometimes that you don't see when you're in the middle of teaching or even in process of videotaping. It's reading her cues. So in this case, we got a chance to see Rinnie in a place where she could truly learn and on something that mattered to her. I don't know that if we had been in the building and I had had a bunch of little cars with wheels that she would have been interested in what she would have gotten from that. But this one she understood because it related directly to her. Okay, vision and hearing. What are the two senses used? Excuse me, I got to get a few things out of the way here. For communication and learning, it's vision and hearing. That's what happens in school. Those are the two major senses used. That's why it's important that if I only even find out that the child's not quite processing, maybe it's about a delay in processing. Maybe they're just a little slower visually processing, and I'm busy shaking the toy in front of their face, and it's like, oh, but you took the toy away too fast on me. Don't do that, because then I can't figure it out. And secondly, I can't show you that I understand something. And that's what we want. We want that child to understand something, and then we can figure it out, too, with them. So here are some red flags. These are things that we'll sometimes hear, and we will ask further questions. Sometimes he seems to see things, other times he doesn't. That's a typical thing that would say to me, I wonder if there's something going on with his vision. I wonder if he maybe has cortical vision impairment. I wonder what the records say about him. I put colorful toys right in front of him, and he either starts to cry or looks away. Another red flag saying, I wonder if I've just got too much going on here, and he's looking away or crying because he can't take all of that information. We have for kids with multiple disabilities, one of the things that really is an issue is people thinking about a multisensory approach. We're going to add the talking in, we're going to add the tactile part in, the modeling in, we're going to talk to them at the same time, we're going to do all of that at once, and he or she may not be able to process all those sensory systems at the same time. When I whisper or talk to her, she smiles or turns her face towards me. And I was talking with Katie about this one, and Katie said, yeah, and then the next question is, well, are you talking directly to her in front of her, or are you talking to one side? If you're talking to one side, is it the right side or the left side? Maybe there's a hearing loss in only one ear. How many of the children that you're working with are actually, whoops, I just lost my thought. I looked down at the chat window, sorry. Katie's making a comment about the fact of the Infant Early Childhood Ed Conference. You can still register for it. There's some great presentations, and she gave you a place to get on. That whole whispering thing, the other question about hearing loss is how many ear infections does this child have? If he or she has a lot of ear infections, that becomes an issue about how they use their hearing, let alone if their hearing is reduced all the times that he or she has the infection. When I look at a child development chart, he's behind in everything, including using his vision and hearing. Does that mean he has a vision and hearing loss? I don't know, because maybe he doesn't have a way to show you that he hears or that he sees, because we haven't offered the right opportunities. I know she has a syndrome. Oh yeah, it's called charge, but the eye doctor said her vision is fine. This is one of the major deaf-blind syndromes in the state of Washington, as well as across the U.S. That has really increased fairly dramatically in the last few years. And the problem is the vision may, quote, be fine, but the issue may be that all the other systems that are part of that syndrome are not fine. And typically vestibular systems, proprioceptive systems are in trouble. Balance is an issue. So don't assume that because the, quote, the vision is fine or the hearing is fine that there are not other issues for that child. She has cerebral palsy in addition to her hearing loss. I think she sees fine. Over 50% of children with cerebral palsy have vision problems. That's a huge number for us not to want to make sure that there's not something we can do to adapt to support that child's use of their vision. I know this child had head trauma very early in his life. He has cortical vision impairment, but there is nothing about a hearing problem. But I am not sure if he understands anything in the family or I am saying. And I did a little informal assessment not too long ago and asked a group of people that I was training, and I said, so how many of you primarily talk to your students with multiple disabilities, and would you say that's your major way of communicating? 84% said that was true. When I asked how many people in the room had a student who had a hearing loss and or a vision loss, 87% of those people raised their hand. So that's just something for you to think about. This infant was in NICU for 2 months. We know there was anoxia at birth. We'll talk a little bit about that. That's another red flag, and we'll talk a little bit about that. The child was diagnosed with a syndrome, but I've never heard of it. We're going to talk more about that. So just so you know, there are people who will take this as through the recording, and they may want clock hours, and if they do, they need to pause and answer this question. But I'm also going to ask you to type in the chat window. What is one thing you can say to a family when you're talking about a child's vision and hearing that considers the whole child and not just, let me tell you about another disability? So I'll give you one from me, and that is that I might say to them, gosh, you know, we're looking at where he is on certain scales, like what he's able to do now, and this looks really good. Let's talk about his vision. What do we notice him doing? What do we notice about his hearing? So that it's not me saying, I think your child has a hearing loss, but it's collecting with that family and looking at it. Anybody else have some thoughts? I just heard a hand raise. Okay, Karen? Karen, if you would like to type into the chat room. So I had an eye doctor that said exactly the same thing about a student with a charge. Talk about communication. That's right. How does your child communicate? And what are things that you're noticing that seem to be a communication from him? Talk about hearing and vision are connected with other concerns, just as sensory processing. Yeah, and when you talk about a concern, I like to just think in terms of what is the child doing and where do we want to go next, instead of this is a concern I have. Sometimes that starts to panic families when the word concern gets used, and you have to feel out each of the families you work with. And I like to think about, well, what is she doing? And then I can compare it to a developmental chart of some sort in the area of vision and hearing and sensory processing. But I don't have to necessarily just like hammer it into the parent that this may be a problem. It might be these are the things she's doing. And the next thing we might want to see her doing, so let's see, are there activities, is there a way for us to fit that into some of the normal family activities you do or routines? Other thoughts? Okay. All right. So just a quickie on this. These are the number of students in 2010 that our project served, I should say, and that gives you the ESD areas and how many students were in each. And this is the number. The red one is the 2010 children. Birth through 5, and now in 2012, just our recent data, you'll see the numbers in the different areas, so where you live, so you can kind of check that out. And if you do have a student who you think qualifies, you need to let somebody know, especially if you're looking for some additional help. So the students on the Washington Deafblind Census in 2010, there were 222. You can see that 49% were children with hereditary chromosomal syndromes and disorders. And Usher is part of that charge we talked about. Just let me get my little cheat sheet here. So some of the major ones are Down syndrome, and then 71 of that 108 were all other different types of hereditary syndrome and disorders. So just so you know, there's such a variety out there. It's one of the reasons we've included one of the handouts for you that talks about the conditions of students. And then prenatal congenital complications, those typically are CMV, microcephaly, hydrocephaly, congenital rubella, and then other complications. Postnatal is the orange part, and that's asphyxia, meningitis, severe head injury, encephalitis, and then other conditions. And then we also have complications of prematurity, which is the brown, that's 8%, and then we have 9% that no determination of etiology. Just so you have a sense of that when you're thinking about who you're working with, to just be aware of. So this is a form that's a handout. I don't expect you to be able to read it off of this. It was just as a trigger for you to know which one to find. I'd like you to just take a moment and look through there and see if you see some syndromes that have shown up with students that you're currently working with. So just take a moment to run down that and look at it, maybe with a pencil check it if that's helpful. So how many of you, using the green check, found either chromosomal syndrome, prenatal, postnatal, that related to any of the children with whom you work? Quite a few green checks. So with that, what I'd like to ask you is how many of you have some connection with our project, WSDS, regarding any of those students? And do a green check too. For those of you who may not have, you may want to think about that, whether or not there are some issues or questions that you have that you're hoping somebody else could help answer. Thanks for your responses, everybody. So just something about vision as a reminder. 80 to 90% of learning comes through vision, especially in young children. So even a mild vision problem or a way of being able to visually interpret what the child sees is going to greatly affect his or her learning. It's why it is so important, no matter how involved that child may be with medical issues and medical issues, I guess usually is one of the pieces that we hear. Even for kids who have intellectual disabilities, we will hear people say, this child's vision is sufficient considering his condition, which is a way of saying, I don't know, in my opinion. Okay, so that was my opinion, just so you know. And glasses don't correct everything. And this is just a great cartoon for me to remember that just because you put on glasses doesn't mean that I can now see everything clearly. For those of us in the aging process who may need glasses, or those of us who've needed glasses for all of our lives, the reality of it is that isn't true for a lot of kids we work with. Just because I have glasses on doesn't mean I'm totally corrected. And that's important to know, just how corrected is it? How close do I need to bring the items, or how far away do I need to have the items? Don't assume that it's about bringing stuff closer to the child. See what he does if he's holding something. Does he bring it closer? Does he bring it to one side or the other? Does he hold it far away? And then this is another handout you have, and it's just that whole piece about thinking about observations and signs and symptoms that may indicate a visual impairment in young children. And this is actually taken from a training that actually Nancy Hatfield and Diane McCutcheon often do about the three-pronged approach. And there's a reference to it down at the bottom of this. But it's a very important thing of thinking about, gosh, does this work? Does something look different about this child? That's the first question. And this is pay attention to how that child's eyes look and what they do. This is a little boy who has something called ptosis. And the issue is the muscles of his eyelids don't work, and so for him to look, he has to really bring his head up high in order to be able to see down because he can't lift his lids. And the family told me, and the team, and he was maybe about 5. Well, the doctor's waiting until he's a little bit older before they do the surgical operation to actually stitch that up slightly to help him. And so one day I was watching him lying on the floor, and he was running his thumbs up and lifting his eyelids up to see stuff. And so I videotaped it real fast, and Mom took it to the doctor, and within 2 weeks they did the surgery. It didn't take the first time. They had to go back and do it a second time. But the doctor said, my gosh, I had no idea that he would be doing something like that because of expectations. And this is nothing against the doctor, but his expectations were, this child is so involved that it really probably wouldn't make any difference anyway. Hearing, it is estimated that 40 to 60% of communication in a classroom is auditory. Now that may not be anything you need to think about. However, studies show that most classrooms around the world have too much noise and reverberation, even for students with typical hearing. And the reverberation is if I'm in a room and there's no rug, no ceiling tile, windows with no coverings, the sound is just bouncing back and forth off of those flat surfaces, those hard flat surfaces, and coming in and increasing the noise level. So think about home and think about the family, and are some of those conditions there at the house? Same thing about the lighting. I went into a home and I thought this child's vision was much worse, and the second time I went back I realized how dark the house was, that the drapes were pulled and there were only a couple lamps on and stuff. And so I said, you know, could we take him outside? And he said, oh yeah, the dad was there. And he said, sure. So we went outside and we went under a tree that had a lot of dappledness to it, and then I took him out, not into the bright sunlight, but into the light, and held some toys up, and he immediately reached for them. And I went, oh my gosh, it's the environment. Yes, he did have a vision problem, but look how the light helped. Those are just another way to assess the environment. It's not just about assessing the child, it's the environment in which he is. So there are signs, same thing for hearing, that I'd like you to feel free to use. Again, it's an adaptation off of the 3-pronged approach, and maybe a little bit later I can talk Nancy into explaining or sharing with you. She's got a couple trainings coming up, and I'm sorry I spaced, Nancy, which ones and where they are. Question number 2, this is going to be for the people on the recording as well as us. So how many and which of the following indicators on the next slide would suggest that the child might be at risk for sensory loss? So I'm going to go to the next slide, and I want you to look at these. And there is, again, I put in more than one. Which one is a new one to you that you hadn't thought about, possibly? And you can just put in number, like the number in the chat box. So I would just type in, for example, if I were going to do it, I would say number 2, and then I would post it. So what are some things you all are thinking? Number 6, child often looks at sunlight coming through a window. When that's the thing that that child's most interested in, yeah, that is a possibility. Great. 5, child's been diagnosed as having visual maturation delay. That sometimes is what it is, and there is something underlying it also. Number 3, child may be startled when touched from behind or from the side. So if I don't hear you coming or I don't see you. 7, child closes eyes when outside in bright light. There are some visual conditions, visual disabilities that comes with, that they're extremely sensitive to sunlight. Number 3, we already did that one. Okay, thanks for all your answers. So what am I looking for in my observations? And we've already been talking about that. I would like you to look at this video clip, and then we're going to talk about it. But what does finding the edges or the boundaries tell us? I want you to notice all the different ways children do it, the different types of children that you see, their different levels of skills, so that you can think about the fact of boundaries show up in many different ways, or edges, as we put in this video. So there are, I think, 4 children we're going to see. All right, so push play now.
Yeah.
Minuses of the different options that you have.
Yeah, he's out here, he's happy. Good acoustics here.
Or grandpa's.
Or grandpa's, that's right.
Or Lainey's. Or Duck's. Or Lainey's.
Yeah. Mimi's?
So what do you think it is about children finding edges or boundaries or borders? What do you say that's about for them? And you can just, if anybody's willing to take some guesses, I really appreciate it. If you already know, put it in there too. Proprioception, safety, both of those. Anything else? Exploring the space, finding out where it ends. Where am I in space in relation to everything else? Security. Those are all great answers. One of the things about that idea of finding borders or edges or boundaries that I have really noticed is that many times children who have impacted vision and or hearing will put more energy into those edges, especially for kids with vision issues, because they need to know where they are in space. And I love what Lily Nielsen, who is a wonderful woman who's worked a great deal of time with kids with multiple disabilities and vision loss, said. Is she said, if I can't come to the room, then bring it to me, meaning if I'm in a little room, if I can move around in the room, I can find where those borders are. I can figure out where I am. If you walked into a room, what's the first thing you do when you walk into a new room? Anybody want to hazard some thoughts in the chat room? I look around. I find out, are there other people here? What's here? Maybe I love the drapes or the color of the wall. I scan it. Great. That's the first thing I do, because then I know where everything is in general. I mean, I haven't gone through the person's drawers and cupboards, but other than that. So I have a general sense of it. For some of our children, they have to go and see what it is. And yes, and see who is here. Who else is in the room? Very important issues for us to look at, but another way to observe children and think about, are they seeing the whole piece or not? Now, this video clip is a short one, and I'd like you to really pay attention to Ben's hands, because I'm wondering, somebody had mentioned earlier about communication was an important piece. And I'd like you to think in terms of, what do you think his hands are about? And it may not be communication itself, but what information do we now know about Ben? So let's push play now.
Working up to being mad. Are you working up to being mad? Hi, Sean.
What's more?
Sean.
Okay. Okay.
Oh, Sean. Hi, yeah, thanks. Good looking.
He do real well at Disneyland and the tea folks. Oh, I hate that.
Come here. John's getting mad.
Spin some more? Okay.
We got some way.
His hands are showing excitement. That is a great thought. Showing pleasure. I unfortunately couldn't see that video for some reason, but since I know this one well, that worked out. He's asking for more. Yeah, his response to his mom's voice. Did he necessarily understand, Ben, do you want more? Do you want me to spin more? Not sure. But he certainly recognizes his mom's voice, and he recognized the anticipation. And that's one of the things, is she did it consistently with him so that he could anticipate, so that he would, when he knew she was going to spin, those hands went down to hold on to the saucer. The edges gave him the security. That is a great comment, just given what we just saw with the edges. There's turn-taking going on. Great comments. So thinking in terms, again, what can I notice? What do I notice? And it's hard when I'm the one who's supposed to be working with the child, if that's the goal for me, is to notice all those things. We only caught it after we got the video footage, and we looked at it, and I said, look at this. And I did not catch it otherwise. Okay, so this is just a quick reminder that we do have sensory channels. We've been talking about the vision and hearing part, but we have taste, we have smell, we have the vestibular part, where we are in space, the motion and the gravity. How do I keep myself up? I think I was watching Andy Rose and the little girl who was kind of bent over, and she was shaking the bells and turning her right ear to it. And one of the things I noticed about that was how much she was folded over on herself. That whole idea of how hard is it for me to work to fight gravity. The proprioceptive and kinesthetic piece, that muscle feedback and resistance. So if I'm holding my hands really tight and I'm making them shake, I can feel that all the way up into my shoulder. I can feel that resistance. That resistance helps. Does it help if I firmly hold a child versus lightly? Some people can't stand light touch. Other people love light touch, or it doesn't bother them. And then the issue of vibration. Touch and the response to discrimination. So there's touch, there's the response to touch, ooh, that's cold, and then there's discrimination. Oh, I feel that thing, and it's round. So as a reminder about all these sensory channels, I want to go on, and you've got a form, and it was one, and you have a sample of one as well as a blank one. And this was something that we developed adapted from Koenig and Holbrook, but we added a piece along with Arizona when I was working with them, and we added the whole issue of not just visual, tactile, and auditory, but also olfactory and gustatory, that's the smell, taste, and then the proprioceptive vestibular, and I just like to call that the whole movement piece. So what we did is, I'll go to the next one, which is the sample you have. It's just done up larger, and that is you simply watch what the child's doing. You write it in the blank, and I don't say see shiny blue pom-pom. I say raise his head up as shiny blue pom-pom is shaken, because I don't know if that's necessarily an auditory or a visual thing with him, unless I know the child really well. And I don't know that he's turning there because he visually caught it, or did he auditorily hear the mylar rubbing against each other. Turns head. So you want to be very objective. If you look down and write another thing, that's fine. That's not a problem, because you're still going to get the information you need. So once we did this, we went back and said, gee, what channel seems to really be at work here? And in some cases, we picked 2 channels because we weren't sure, and that's okay. And in some cases, 3. But what happened is we saw that the visual was a total of 5 in that observation, 10 for tactile, 8 for auditory, 1 for olfactory gustatory because it didn't have a lot of that in it, and 18 for movement. So when I showed that to the team about the little boy, they said, oh my gosh, everything we're doing in preschool is all auditory and visual. And I said, well, let's talk about how we might be able to add the tactile and the movement. And they came up with great ideas. You know, they said, well, when we're doing the songs, you know, we could have a different object that represents that song. And so they did that for 3 different songs. And he had those objects, and every time that box with those objects were in, he immediately went to the baton. And the baton's the thing that represented row, row, row your boat, and it was he held on, the adult held on, and eventually they did it with peers, and it was row, row, row your boat, and he would pick that thing every time. And what we really found fun was at home, his sister had brought a baton home. He found it on the floor, and he started to make the motion, row, row, row your boat. But Mom didn't know what it meant. She said, I couldn't figure out why he was doing that. But what great generalization on his part. So this is a tool that can be used, and it can be used as many different ways as you want. But I like to look at it during activities in which the child sometimes has structure, and then times when it's not structured and he has his own choices. So I'd like us to look at these 2 videotapes and talk about, well, actually it's 1 videotape with 2 girls on it. And I'd like you to think about those sensory channels we talked about: vision, hearing, tactile, proprioceptive or movement part, the smell and taste, touch. So I'd like you to take a look at that and identify in the chat room, once you've seen it, decide for yourself, what do you think some of those stronger sensory channels are? So we're going to push play now.
Hang on. Are you going back to that? Okay.
Okay, so people are talking about proprioceptive vestibular or movement and the tactile, the touching the wheels, feeling it. So that those might be channels that you really want to look at when that child is doing what he wants to do is, oh, okay, I got it. She really likes the sound, or she really likes the feel of things. So I want to make sure some of the toys that we may be playing with have some different feel to it. Also adding auditory for the second child. Constantly shaking something that made sound. Again, grabbing the Mylar, and not just for the tactile, but the shaking it to hear it. Once again, it was on that right ear for her. So those are some things that you want to think about, is where are the strong sensory channels for this child? It's another way for you to get functionally with families to something, to observe it and say, gosh, that seems to be a strong channel for him or her. Did you notice that? Yeah, she really seems to like things that make noise, or she really likes, it's important for her to touch stuff. So let's think about how she can touch more things. And we're going to be a little bit rushed at the end of this just because of the fact that we had to start a little bit late because of a few of our technical difficulties. So I apologize, but this is another informal observation tool. And it's called a Velcro vest, and it can be any vest you buy at the Goodwill or that the family already has. And you can attach with Velcro different items for the child to explore. One of the reasons that this is so nice is that if the child has some hand issues, then I can place them wherever on the vest their hands tend to be. So if you have a child who tends to bring their hands into their body a lot, and that's where they are most of the time, if I have a vest on them, or as a mom, if I've got an apron over that's got the Velcro on it, that she can sit on my lap and play and explore things. I've now found a way for a child who may not be as ambulatory or moves as much to actually be able to explore. You can also do this on their feet, and for some children, using their feet works way better for them initially, and they'll explore with their feet. So this is just another way to do some observation about what the child likes, and getting that child to use their hands and initiate. Initiate, initiate, initiate. Because if you get initiation from the child now, when you all are working with them young, then I don't have the situation recently where I observed the child's videos, and I was so happy. But this child is 16 years old, and I said, I can't believe how much she's initiating. 16 years before she starts to initiate. That's what we don't want. That's what we want you doing, so that that's not an issue, so that the level of independence increases at whatever level the child can handle. So this is, let's watch this video, and this is the one with me, and I'm going to tell you already, this was my first day to meet him. I was sitting behind him. I wasn't sure that was going to be tolerable on his part either, but he managed. This is in a preschool classroom. It was like his maybe second week in preschool. So there I am in the back, and remember, I can tell you all the wrong things. So you can say them too. Press play now. Watch his hands.
And this side, and last name. We're doing that this week. When do you think you're big enough to learn your middle name? You're going to see the teacher's logo on there. Caleb Noble Hunter. Do you have an O? Such interesting middle names. You sure do, Caleb. Good afternoon. Glenn. I can't believe this.
What is his?
Look at his middle name is so similar. Noble and Nolan. That's very similar. Glenn. Now this is different than yesterday. Glenn, do you have an O in your name? That's it, Glenn. Thumbs up. You're right. And good afternoon, Glenn.
Glenn has
Yeah. John. You're right, John. You have one on. Good
and
afternoon.
I have a little H at the very back.
Yeah, you do. Oh, Courtney Matt. His middle name is Matthew. Still, he has one. And he won't be here till tomorrow.
raise your hand if you have an O. It's different now. It's different. Nicholas does. Now
So what my goal was in that was to, again, observe, participate. He was very tolerant of me, considering he didn't know me. And one of the things that he's showing hand movement with his left hand. Is it intentional? Did any of you get the idea that initially it was intentional, unintentional, and then it became intentional? Yes, wearing a vest would have been good for his left hand at times when he wasn't engaged in something else. So that whole thing of when he slowed his hand down and rested more on mine, I was trying to figure out, would my working under his hands be tolerable to him? So I was doing an observation with him to see, if I put my hands under his, will he slow down instead of this constant movement that he was doing, okay? And that's what I was looking for. Did I go too fast? Yes, I needed to slow down, and I'll say that to you all the time, and everybody who works with me always says, I know, slow down, because that is one of the issues. We need to go at their pace, not our pace, and especially when we're doing observations and trying to see what it is they're doing or they're wanting to do. So this is another informal observation tool and activity board. You just make things, and I happen to do it with commercial stickiness of Velcro so that I can actually move things around on it so I can check out a child's preference. Does the child have reaching access to all the items on the board? If not, then maybe you only fill part of the board. Does he play with one item more than the others? What does he do with that item? If you switch locations on the board, what happens? Does he find it? And then this is a triangle board, and anybody who's interested in this information, you can go to, let me find it for you. Oops, no, I can't. I've got to do that first. You can actually go to our website, and if you're interested, feel free to email me, which will be at the end of this. And I can get you directions for any of these, but I'm going to go ahead and move a little bit more quickly. But it's another way to observe a child, especially a child who's not as mobile, who can't get to things. And that's true for a lot of our children, that they can't get to things. And then question number 3 is identify at least 3 informal observation tools to use when looking at how the child uses sensory channels. In that case, one of the things you want to think about is the fact that, does this child actually bang things so that maybe auditory is more important? Are they orally exploring everything? Because we have some of the most sensitive receptors orally inside of our mouths. What are some of the things they're doing? Are they looking at it and bringing it up close? What are they doing with the things that they're playing with? And what are the things I want to put on there? And we'll talk more about that next time. Just a reminder to some of you, a lot of you know that Washington Sensory Disabilities Services is there to help families and provide service providers by supporting the development and learning needs of children aged birth to 21. Who are deaf, hard of hearing, blind or visually impaired, deaf, blind, or combined vision and hearing loss. And you can contact our project in case you're looking for some assistance in looking at, especially at how that works for the child. We also have video topics on our website, which is at the bottom of this, about experience books, the hand under hand that I was attempting with Glenn to see if he was open to it, likes and dislikes, peer programs. You can read those, and we have recorded trainings that you might find useful, and I'll point out that the 4-part training called Active Learning has the items that I showed at the very end that have more in-depth information that you can get to on our website. And then there are other trainings coming up. Some of you already know about the Infant Early Childhood Ed Conference. It's the dates there and how to get to it. combined Summer Institute is July 30th through August 2nd in Wenatchee. There's a multiple disabilities strand, and there's also a preschool strand on deaf, hard of hearing. And Nancy's also a good access to get information, but also if you go to that website, you can see all the different presentations that are going to be there. Let's see here, I'm almost. And then our next training, which is really going to focus more on, so what strategies do I use and how can they work in routines and work for the family and their activities? Let's see. And then we also have, I'm not sure if you saw, but Michaela typed in an evaluation because we're always looking at how we can improve these, make them work better for people. So if you could go to that www.surveymonkey.com, that's there, and answer 5 quick questions for us. We would really appreciate any feedback you have. And these are the resources that we talked about, so please, and then my email is down below, so for any of you who might be interested, please feel free to email me about stuff. Go to our website, experiment with the trainings, experiment with the video topics, and very shortly, we actually we're excited that under the video clips we right now have for a lot of kids with multiple disabilities and a vision and hearing loss, but we're soon going to have actually video clips from the baby jamborees from the last couple years for kids with vision loss and young birth to 5 age children, I think mostly birth to 3. And Nancy, is there anything you would like to say at the end of this about that whole piece that maybe I've left out? So you, go ahead.
Hi. Oh, I like my picture. That's my high school graduation picture. I believe that Katie just made those pages active, the birth to 3 blindness and visual impairment video. So if you go to our website and just go to the video tab, you'll see all of the videos in blindness, visual impairment, infant toddlers, and then in the deaf blind area. So and I know you wanted me to mention the trainings coming up in May. These were announcements were sent out through the ESIT listserv. One of them is on May 16th in Chehalis, 9 to 12:30 on the 3-pronged approach. And then the second one is May 22nd in Yakima at Children's Village from 9 to 12:30. If you want more information, contact me. My email is on the WSDS website, and I'll also type it in the window. Thanks.
Thank you very much. And listen, thanks to everybody for participating. I always appreciate and learn, and I see people notice things in videos that I go, oh yeah, I missed that. So that's what's so exciting about videos, that we can talk about it. So with that, I'm going to let you all go and have a great evening, and we'll see you all May 15th, I hope. Take care. Bye.